Good morning and welcome to the 19th meeting of the COVID-19 Committee. We have received apologies from Monica Lennon, MSP, and Beatrice Wishart, MSP, who are attending other parliamentary committees this morning. And I'd like to welcome Mary Fee, MSP, who is a substitute for Monica, and Willie Rennie, MSP, who is a substitute for Beatrice, to the meeting. I will now turn to Agenda Item 1. The first item on the agenda is a decision to take Agenda Items 3 and 4 in private. Are members content that we take these two agenda items in private? And if any member disagrees, can they please indicate this in the chat function now? I can see that no member has indicated that they disagree, and as such, we all are agreed, and I turn now to Agenda Item 2. Agenda Item 2 covers the Coronavirus Act's two-monthly report and Freedom of Information report to the Scottish Parliament. This morning we are taking evidence from the Cabinet Secretary for the Constitution, Europe and External Affairs on the Scottish Government's third two-monthly report and second Freedom of Information report to the Scottish Parliament under the Coronavirus Act. We are also considering three SSIs. The Health Protection Coronavirus Restrictions and Requirements Additional Temporary Measures Scotland Regulations 2020 SSI 2020/318, the Health Protection Coronavirus Restrictions and Requirements Additional Temporary Measures Scotland Amendment Regulations 2020 SSI 2020/325, and the Health Protection Coronavirus Restrictions and Requirements Additional Temporary Measures Scotland Amendment Number 2 Regulations 2020 SSI 2020/329. The Cabinet Secretary is accompanied by three supporting officials from the Scottish Government, and can I welcome them to the meeting? They are Jason Leach, National Clinical Director, Jerry Hendricks, Head of the FOI Unit, and Jenny Brough from the Coronavirus Legislation Coordinating Reporting Team. Can I welcome you all to the meeting, and Cabinet Secretary, may I invite you to make an opening statement?
Thank you very much, Convener, and I'm grateful for the opportunity to be at the committee yet again to give evidence. I'd like to deal with the two items that you've mentioned and one more in my opening statement. The two will be the reports and the new regulations, but I also want to mention the issue of scrutiny with your permission. I'm pleased to be here to discuss principally the Scottish Government's third report on the Coronavirus Act, which, in line with the Scottish Act and our commitment to also report on the provision of the UK Act, was laid before Parliament and published on the 6th of October. And of course, I made a statement to the Parliament at that time. Our third report covers the third reporting period under the legislation, which ended on the 30th of September. And in addition to the reporting requirements set out in the Scottish Act, we've reported in more detail on a set of 22 provisions, which we've judged at this time to be of most impact or of interest to the Parliament for other reasons. For these provisions, we've sought to provide detail over and above the reporting requirements set out in the legislation and the operation of the powers. And I want to pay tribute particularly to Jenny Brough's work on this, who has been leading this work since its inception. Our third report also sets out where provisions within the Scottish Acts which were deemed to be no longer needed beyond 30 September have been expired, as well as detail of the separate regulations which have been made to suspend provisions relating to vulnerable adults and to Muirburn, which are not currently required, but may be required at a future point. Finally, we've reported on the total of 49 SSIs, where the main purpose relates to coronavirus as required under Section 14 of the Second Scottish Act. This excludes those made by Scottish ministers under the First or Second Coronavirus Act or the UK Act, as SSIs made under those acts are already being reported on. I would also be happy to discuss the Second Freedom of Information report, which is required by paragraph 12, Schedule 4, the Second Coronavirus Act, was laid before Parliament on the 9th of October. As the committee knows, the government has been exploring ways not just to enhance the reporting process, but to enhance parliamentary scrutiny of COVID regulations. And the First Minister indicated yesterday that we are very keen to do so and to take this issue forward so that there is more intense engagement between members of the Parliament, entirely legitimately, and those who are having to make these decisions and bring the regulations forward. And we're therefore committed to putting in place the following arrangements with effect from the 9th of November. That will be a week after the new process comes into place. What is being changed is that if a change is proposed to the levels approach approved by Parliament last night, the government will advise Parliament of the proposed change by way of a plenary statement, normally on a Tuesday. Members will be able to question the government on the planned change. Draft regulations will be published, normally on a Wednesday, and those are draft regulations. If it so chooses, a committee, for example, your own committee convener, may wish to take evidence from the government on Thursday. And following any committee consideration, the government would make the regulations to come into force at an early point on Friday, of course bearing in mind the views of the committee. In exceptional circumstances, the government will propose to facilitate a plenary session on Thursday, when very significant regulatory changes were in prospect. The expectation is that the normal approval process and the plenary vote on the regulations would still happen at a later date. Parliament would therefore be able to offer on the regulations a view both before and after they are made, and they would influence the making of those regulations. Now, this adds a very significant additional scrutiny dimension to the current arrangements, but it's balanced with the need to move at speed to protect public health or to remove restrictions at the earliest point. And I hope this approach will be welcomed by the committee and by the Parliament. I'm also here, of course, to present the 3 further sets of health protection regulations. The regulations to be discussed today introduce some additional temporary measures at a national level and also provide for some specific tighter measures across the central belt during this temporary period. The regulations adjust the requirement to wear face covering in certain settings and situations at a national level too. The Scottish Government made regulations by way of made affirmative procedure on the 9th, 15th and 22nd of October. These regulations entered into force on the 9th, 10th, 16th, 19th and 24th of October. They are due to expire on the 2nd of November. Outside the central belt, indoor hospitality venues are required to close between 6 p.m. and 6 a.m. Licensed premises are not permitted to sell alcohol for consumption inside, but can sell alcohol for consumption outdoors. Licensed premises can continue to sell food and non-alcoholic drinks for consumption indoors. In the central belt, licensed hospitality venues other than cafes must close their premises to the public for the duration that the regulations are in force. Other hospitality venues are subject to the same restrictions as those outside the central belt. The regulations restrict indoor group exercise classes for those aged 18 and over from taking place, and also restrict contact sport for this age group unless it is for the purpose of professional sport. The regulations restrict outdoor live events from taking place in this geographical area and require the closure of snooker or pool halls, indoor bowling, casinos and bingo halls. The regulations being discussed today also make adjustments to the requirement to wear face coverings nationally, both loosening the rules for couples entering a marriage or civil partnership and tightening the rules in workplaces to provide those who cannot work from home with some extra security. The regulations also require retail premises to return to 2-metre physical distancing, having previously been provided with an exemption that allows 1 metre distancing to be applied. The regulations to be discussed today are set to expire at 6 a.m. on Monday the 2nd of November. Now, as the First Minister set out previously, we will be bringing forward regulations to implement the new levels-based approach across Scotland from the 2nd of November. The regulations will implement the policies set out in the strategic Parliament framework that Parliament debated yesterday afternoon and approved. Convener, I hope that the committee has found these committee's comments helpful. I'd be happy to take any questions that you and your members have.
Can I thank you, Cabinet Secretary, for that statement and also for your comments in particular around parliamentary scrutiny, which is something that I'm sure colleagues on this committee will want to discuss amongst ourselves, but I am grateful for that. Can I turn now to questions, and if I may begin by asking the first question. We received a submission from the Highland Council that highlighted, to paraphrase them, that while initial broad announcements have been clearly articulated by the Scottish Government, amending secondary legislation and subsequent guidance does often not happen, or the relevant documents are not published until up to 2 days after the announcement. And they state, and I quote, they give an example: the amendments to the Health Protection Coronavirus Restrictions and Requirements Scotland Regulations 2020 relating to the closure of pubs were not published until the afternoon of Friday the 9th of October, when some of the measures introduced were due to commence at 6 p.m. on that day. And they say that the expectation from licence holders is that they need advance notice of what the measures will be and expect instant guidance and advice straight after the announcement. Can you elaborate on what is being done to address that issue, both under what has previously happened and under the new framework?
Yes, of course. And of course, we want to make sure that the regulations are as clear as possible and as easy to follow as possible. But of course, they are also being laid, in the midst of a public health emergency, where time is often of the essence, and making sure that we make changes promptly will affect the outcomes of those changes. And we want those outcomes to be positive, and we must remember what those outcomes are, which is basically to save lives and certainly prevent the spread of the virus. So there are a number of balancing considerations here. But the principle must be to be as clear as possible. And I think it is obvious that now, in moving to the levels approach, we are moving to an approach that is easier to understand. We've been, to a certain extent, changing and developing the regulations as we've gone along. There was a period of intense regulation at the very beginning, then a period when those regulations were relaxed. We've now got a situation where there are different approaches in different parts of the country, given the nature of the pandemic there and the spread there, as a result of which, it has sometimes been difficult for people to understand, and I recognize that. What we're trying to do is to make it easier to understand and quicker to understand and have the material more quickly. And I think the scrutiny process, very important as that is for the Parliament and for democratic activity, will also be important in that regard. I mean, what we've tried to lay out, what we've tried to discuss with people, and we have been discussing this extensively, is a process that allows a period of time to elapse. So a plenary statement on the Tuesday, a publication of draft regulations on the Wednesday, a consideration of those on the Thursday, and the introduction of them on the Friday does give a good period of time to allow things to be finalised. I also want to very strongly commend the work of staff on this. Sometimes the work here is incredibly intensive by civil servants who've got to react very, very quickly. And there are a range of options to consider the scientific advice, to lay against that the four harms, the issues that require to be considered, all of which is undertaken and all of which requires considerable thinking, and the involvement of ministers and the cabinet is a complex process. We want to make sure that everybody understands it, everybody has a chance to look at it, and everybody in the end can agree with it. And that's what we'll endeavour to do.
Thank you for that. My next question covers both the old and the new, and it's really relating to the localization of measures. Now, I think we've all accepted that local authorities are the areas in which restrictions are imposed. But some of the factors which determine the tiers in this new framework are, of course, NHS board related. And as we all know, NHS board areas and local authority areas don't mirror each other. So you could, for instance, be in a local authority area with a low rate of virus, but have higher restrictions imposed on you due to your wider NHS board area and issues involving NHS capacity, which of course are justifiable, might determine your own restrictions. Do you accept that? And does it perhaps contradict a more localized approach? And maybe Professor Leach might want to come in here as well.
Yeah, let me say a word or two before Jason comes in on it, because the First Minister addressed this yesterday. And if you will allow me a moment of special pleading, I am particularly concerned about this given my own constituency, where there is a very substantial difference in various parts of my constituency. Argyll and Bute has a low incidence, and I'm pleased to say that it is falling. But we also have areas, islands, Tiree and Coll, Mull, Iona, Isla, and Gia, closer in islands, where there's virtually no incidence, and in some cases has been no incidence. So how do we recognise those differences? Because Argyll and Bute is a local authority area, but is actually in the Highland Health Board area, but is of course subject to restriction and is likely to be subject to restriction at a slightly higher level, for example, in the Highlands. Now, the First Minister mentioned this specifically in her statement yesterday, and I want to quote from it because I think it's really important. It is not without its difficulties, and I'm sure that Jason will indicate those difficulties. And indeed, for example, in island communities, there may be issues of restrictions of travel, but it is recognised as an issue. And she says, the First Minister said, assuming Parliament agrees the overall framework today, I will confirm on Thursday what level each local authority will be placed into initially. This will be in effect from Monday, be reviewed on a weekly basis. These decisions were based on advice from the government's advisors and the National Incident Management Team. We're also consulting with local authorities. While we will initially apply levels to whole local authority areas, We will look in future at any situation where it might make sense to be more targeted. And she said, for example, a different approach for the Argyll Islands than the rest of the Argyll and Bute Council area. So there are those circumstances. Now, some anomalies are impossible to resolve. There may be a difference of a street in some areas, but in other areas there is a very substantial difference, and we should be aware of that. But this is a matter for developing the application, and we must maintain maximum vigilance as well. So nothing we do should weaken that vigilance. But perhaps Jason would like to say a word or two in regard to that too.
Thank you, Cabinet Secretary and Convener. You've covered it well, I think. This is the biggest change to the way we handle this pandemic since the route map. And therefore, the local public health teams are nervous about that level of change. They want to get that right. They're also mindful that the present restrictions appear to be working. The numbers appear to be decelerating, although we're not back to, unfortunately, yet where we were, but they do appear to be going in the right direction. So this major change, of course, makes everybody worry a little, particularly those who are running the public health response in local authorities. And they work for the health boards. They are in constant dialogue. I did a lot of the local authority calls yesterday with the Deputy First Minister, and it was tangible how closely connected the public health teams were to those local authority leaders, and it was very encouraging to hear that. Far be it from me to correct the Cabinet Secretary. I'm going to add one word to what he said, and that is that the bits of Argyll and Bute that have low incidence presently have low incidence. So that's what makes us nervous. This virus, it takes almost no effort for this virus to get to one of these small communities and to spread very quickly. That doesn't mean we shouldn't take a more regional approach over time, and we shouldn't consider that with local public health teams. That's where I would take that advice. They know that much, much better than I. If that comes up over time, then we will, of course, consider that being part of our advice into the decision makers. I would illustrate the challenge with that using Lanarkshire. So South Lanarkshire, very, very rural in areas, and could make a case for some of that local authority division. South Lanarkshire feeds to the 3 Lanarkshire hospitals, the 3 intensive care units in the Lanarkshire hospitals. They presently have a capacity for 30 intensive care COVID cases. 30. Now that's already double what they would have in conventional times. The present modelling says that in 6 weeks' time, we will need 76. 76. Unless we do something. And that's what we're doing. We're restricting people's liberty. We're making people stay home. So that's the dilemma. If somebody in rural Lanarkshire needs an intensive care bed, and the intensive care beds in Airdrie, Wishaw and East Kilbride are full, what do we do? And that's of course the challenge with Argyll and Bute, with bits of Highland, and you can make that argument for almost any local authority. So the public health advice will of course consider the local scenario, but it will also have to include the admissions and the ICU capacity.
Thank you both for that. My final question is to Professor Leach again, and it's a rehash of a question I asked him about a month ago. I hope he forgives me for it, but it's to ask about the efficacy of restrictions. It's now, I think, been just over 8 weeks since the ban on household mixing was introduced in Glasgow, East Renfrewshire and West Dunbartonshire. And I suppose my question is, are you able at this stage to gauge the efficacy of those measures, and what exactly are you measuring?
It's a key question, but in general terms, yes, the measures are working. The challenge, of course, with this virus is its long incubation period, and then its long, what we often don't consider, its long illness period. So you don't end up in intensive care the day you get your first symptom. You end up in intensive care usually 3 to 4 weeks after you get your first symptoms. So the length of time of illness is quite long, and that varies from Ebola to the flu to norovirus. And this happens to be this long. There's absolutely nothing we can do about it. So therefore, when you layer restriction on restriction, it's quite hard to prove causation. But on the 9th of October, I and my senior colleagues published an evidence paper that said at that point, the modelling suggested we were doubling every 9 days. And that's one of the reasons why we advised more restrictions that week of the 9th of October. That day, we had 1,045 new cases, 1,045. That would have meant on roughly the 16th of October, we would have had 2,100 cases, which we didn't have. We had about 1,400 cases. And individual days are a little bit tricky. You should look at trends, of course, but we didn't double in 9 days, for sure. You've seen that now stabilised over the last week, 10 days, and it's now around 1,100, 1,200 each day, with a little bit of a backlog to catch up. So we are not accelerating like we did in March and April. So the public health advisors are confident the present restrictions are working. My coda to that, unfortunately, convener, is the pace at which they work is also crucial, because the people who catch the infection today will end up in hospital in 3 weeks' time and could potentially die in 6 weeks' time. So we are hardwiring in, any delay hardwires in death and misery and infection on an ongoing basis. So that's why it's so difficult to judge which interventions to do at which time. And you can see every country in the world struggling with that. And one of the reasons to switch to this regional system, which a lot of countries are doing, there are a variety of options globally about how you manage phase. We have chosen, the decision makers have chosen a regional approach, is to try and get that a little bit more agile so you can stamp on the places that have higher rates as quickly as you can.
Thank you very much for those answers. Can I now turn to Mary Fee? And Mary, if you have any relevant interest to declare before you ask your question, could you do so?
Thank you, convener, and I have no relevant interest to declare. And good morning, Cabinet Secretary and panel. I have 3 questions I would like to ask the Cabinet Secretary this morning. The first one is around the suggestion that the Children's and Young People's Commissioner has made that there is a need to update the Children's Rights and Wellbeing Impact Assessment. And this has been raised before, and I know it's something that the government has been looking at. I wonder, Cabinet Secretary, if you could give us any update on the position and whether or not these are being updated.
I know that there is consideration being given to doing so. I'm not aware of a final conclusion to that, but I'm very happy to find that out and to write to the member in the committee. I know that there is a sympathy still to do, and I think that the focus of the report has been on rights, and I know Mary Fee is a very strong advocate of rights and very experienced in this area, and we agree that that is the issue of rights right across the board should be central to this. So I'll find out and I'll come back to you.
Thank you very much for that, Cabinet Secretary. I'd be grateful if you could update me. My second question is something that the education unions have raised, and that's on access to digital learning. And there has been a call to include blended and remote learning as we move through this pandemic. And I'm specifically thinking on the impact all of this has on attainment. And it's very important that children have access to learning. And I appreciate the Cabinet Secretary may not be able to give me a huge amount of detail. I know the Deputy First Minister has been looking at this, but I wonder if there is any update he can give me.
Well, again, I always find myself at these meetings as sort of Minister for everything, and I'm very aware that I shouldn't be, and I should provide members with the real information as opposed to a gloss upon it. So I will ask the Deputy First Minister to do so, but can I just stress that the priority has been to make sure schools are open, young people are in schools, and that they have the opportunity to have as near normal as possible a learning experience as they can have. And that has been very, very important to us from the middle of August when the schools reopened, and has remained so as we've had to reintroduce regulations and restrictions. That has been a pretty sacred objective and will remain so. But of course, there are issues that arise here in terms of inclusion. There are issues arise here in terms of digital exclusion, and they all have to be addressed. So again, I will ask the Deputy First Minister to respond directly to the member and to the committee.
Thank you very much. And my final question is around comments that the Law Society has made, and that's on the impact that the emergency regulations have had on the human rights of vulnerable adults and adults with incapacity. What learning has the Scottish Government made about the way they decided to take this forward, and what changes, if any, will they make to make sure the human rights of vulnerable adults are protected going forward?
This is a really central issue and has been. Monica Lennon has raised this too, other members have raised this. It is a central issue, particularly in the emergency legislation. And I think with the absolutely best of intention, there was a legislative step taken that would have allowed continued support and continued legislative support and a legislative framework for those adults with incapacity and for their rights to be protected, but would not have been as good as the situation which was existing before the pandemic and should exist after the pandemic. Yeah. Now, one of the issues is what has been in between there, what happens during the pandemic. And if, as we have found, there has not been the pressure upon those support services that we thought there might have been, and if it has been possible to operate them in a normal way, they have been operated in a normal way. And I think the statistics have shown, I've used them before at this committee, that in actual fact, the vast majority of those involved have not used those special powers, and indeed those special powers should not be used in those circumstances. So I think it has been I may put it this way, a pretty classic example of where the difficulty lies with emergency and very unusual legislation in a pandemic. None of us have experienced that before. And the basic commitment we have to human rights for all, and particularly to include those who are least included and who require most. And I hope we have managed to manage that and done it sensitively. More importantly, I think local authorities have and responsible organisations have. But I think we're moving out of that, and I think it would only be in very much worse circumstances that we're in now in terms of the public sector and its operation that we would have to return to it. I hope that's helpful.
That is very helpful. Thank you, Cabinet Secretary. Thank you, Convener.
Thank you. Can I next turn to Willie Rennie, please?
Thanks, Convener. I want to talk about the mitigation, the financial support that's available for businesses that are affected by the new restrictions that are on the way. With the change of the opening hours, particularly for hospitality, many of the businesses will feel that they've got no other choice but to close, but technically they will not be forced to close. Yet the grant support levels are either for those who are closing or hardship support for those who are affected by it. Now that is also obviously already in places like Fife and Tayside that are in level 2, and many of those businesses are closing, but even though they're not required to. Now, you could probably survive for 16 days without maybe some support, although it would be tough. But if this is going to be the ongoing structure of the financial support, I think there's a problem. And I just want to know whether the government's going to change the structure of the support to recognise businesses that are effectively got no choice but to close, even though they're legally not required to. Effectively, the grant support will be cut by a third, which is quite significant for businesses.
I think I have to say to Willie that were we entirely free to operate in the way that we would like to operate, with the resource that we need to operate, I would 100% agree with him. And I would want to make sure, because I'm a constituency MSP and he is a constituency MSP and he is receiving, I am sure, as I am receiving, very, very strong representation and entirely justified representation from people whose businesses are on the line. Good businesses that they have operated well and which they believe they can continue to operate well. But we are not in that position, and therefore what Fiona Hislop and Kate Forbes have to do is to try and find as much as they can to create the circumstances in which there is support for everybody who needs it. Hardship is clearly has to be one of the considerations in there because there have to be criteria. But I think I can do two things for Willie Rennie. One is to say that we will continue to try and do our utmost to support all of those who have been affected for no other reason except that there has regulatory change has taken place, important regulatory change, essential regulatory change, and they have had to not operate within it. And we will also continue to seek the resource that allows us to do so. Now, I think the points that were made yesterday in the debate were important in this regard. I think that listening to business and listening to the type of point that Willie Rennie has made about requirements and actual requirements on the ground is important, and we will do that too. I think also I should say that I would think Fiona Hislop would want to respond more fully to Willie Rennie in the light of his observations. But there is no resistance to providing support. There are those practical difficulties of the resource that we have, and we may not agree across the committee on this, the fact that we do not believe that that resource has been provided adequately or significantly in the way that we need.
I agree with Mike Russell about the overall level of support, and it's not sufficient, particularly for the larger businesses who have got greater costs, even though they're remaining closed. I suppose what I'm particularly pointing to is that even if South Lanarkshire, or only if South Lanarkshire and North Lanarkshire move into level 4, will the hospitality businesses get the full support that's available because they'll be required to close. So in some ways, the new structure eases up the finances on the government in that respect, in that narrow respect. And I just think it needs to have a re-look at all that. Now, I understand he's not the Minister for this, but I'm not going to press him any further on the detail on that. And I will take it up with the Economy Secretary and the Finance Secretary to explore that further. But I think there is a significant issue here because this is a long-term setup, not just the 16 days, and because we've restructured it in terms of compulsion to close, then I think it does that. If I could move on to another area, I'm interested in how areas get down to level 0. Because if you look at the Highlands and the Islands, their indicators on the documentation that was provided yesterday are all at 0. Yet the indication is that they'll only move to level 1. In fact, it's level 1+ with the indoor meeting in place. I don't know how they get down to level 0. What do they need to do? What are the indicators? Is there such a thing as -1 that takes them down to the 0 level? How does that work? Because people want to have some kind of clarity and hope on this, and I'm hoping the Minister can maybe help.
It's a very good question. I think Jason Bleach should address it. It is dependent upon a variety of clinical and medical factors, as well as an assessment of the harms. And I mean, just before Jason does, one of the issues that emerged yesterday, as I'm sure Willie Rennie remembers, is this issue of judgment applying to advice. And this will be an area of judgment and advice, as all these will be. But I think Jason should address
it. We had to set the dial somewhere for each of the basket of measures that we put in, but they're not the only measures that the National IMT will have to consider, and they're not the only measures the local public health teams will advise upwards. So the system will be local public health teams into their directors of public health, into the National Incident Management Team, into the senior clinical advisors, me and others, and then into a 4 harms consideration. So 0, 0, 0, 0 in the grid doesn't necessarily give you a 0 in your overall assessment of what that local authority should do. You have to consider how long the numbers have been reducing or at a low level, and then you have to feed in the other harms. And that will have to include tourism and transportation risk. It will have to include how well you can isolate out that particular piece of the country without travel, because you can't have people coming from a 4 to a 0, because you're just going to be back where you started very quickly. We know how quickly this virus is imported into countries or pieces of countries. So as we move forward and we get this first one over with, then there will be a weekly rhythm to this assessment, both from a public health perspective and from the chief economist and from the chief social researcher, in order to advise Mr. Russell and the Deputy First Minister and the CABSEC for Health on what they should then do around the decision making about each local authority. So you can get to 0, But the present position of the senior clinical advisors in Scotland is that no area in Scotland is ready to get to zero because of the state of the pandemic nationally, which we will have to consider, because we cannot isolate out pieces of the population enough for us to be comfortable that any part of the country should move to zero presently.
That's fine. Thanks, Convener.
Thank you. Can I turn next to Shona Robertson, please?
Thank you, and good morning, everyone. I have three questions, one about scrutiny and then the other two of a more local nature. I think the arrangements that have been described, Cabinet Secretary, are very welcome. I guess there's one question that occurs to me around the advice that you outlined that government bases its decisions on. You cited scientific advice, the four harms. You said it was a complex process. A question in my mind is, how then does Parliament make an informed contribution and informed scrutiny of government's decisions, given all of that information? What's the government thinking about how much of that can be shared, how it would be shared in such a quick period of time in order for Parliament to make informed decisions about what the government is putting forward?
Yeah, I think it's a good question. I think there are three levels on which we might look at this. The first of which I think was a constant theme in yesterday's debate, which is there is a huge amount of published information on a daily basis. And when people ask for more data and more information, they are often asking for things that already exist. They simply don't know that they exist. They're there. So I think there is a job to be done to continue to point members to the information that is published. The dashboard is a hugely useful piece of information. You can drill down very deeply into it. You can learn a great deal. And this does require work. I mean, this is a complex subject. There's a huge amount of detail within it. So there is that information, and it is there. And I would hope members would inevitably keep up to date with it in their own areas and more widely across the country. The second one is the judgments that they will bring to it from the representations that they receive from their constituents. Every single member will receive regular and sometimes pretty overwhelming representations on a range of issues. They have to apply their judgment as well. We are. I don't want to go into Burkean philosophy of what public representatives are, but we are not mere mouthpieces. For a range of individuals or interest groups. We have to reach judgments ourselves. Willie Rennie has rightly raised the issue of people in hospitality who are in very difficult circumstances, yet are not directly affected by the regulations. So we have to look at this and come to judgment ourselves and build up our own knowledge, which should not be difficult to do if we're in day-to-day touch with our constituents about where these things are. But there is also an obligation on the government, and I do accept that, to publish information. I think we have to publish analysis and to synthesize information. And I think some of the publications over the last month where information has been brought forward, analysis papers have been brought forward. That's also true with the information that went to COSLA this week. Is important and should be made available, widely available. There isn't anything. There's often a view. Across politics, in some sense, governments are withholding information. There is absolutely no point in withholding information on the nature of the pandemic. Indeed, it would be utterly counterproductive, because we need to persuade people of the serious situation that exists and the measures that are necessary to overcome that situation. So, some sort of view, and I heard a couple of views about it in the chamber yesterday, and they seem to be incredible in my view, that there was some reluctance to give information. That is not the case. But there is sometimes information asked for which does not exist, which has not been brought together, or which would be disproportionate in terms of effort to bring together. There are always a limited number of people on the front line in this. If you take people off the front line to count things, you actually reduce the front line. So we need to have a balance in there. But I think all of those things taken together, I think the scrutiny process informed by well-informed MSPs is a vital tool. And actually, it's going to improve this and help to tackle the virus.
Okay, thanks for that. It was helpful. As you just alluded to about our mailbags, clearly, coming back to my locality, there's a level of anxiety at the moment around Dundee's tiering or level, which obviously I don't want to prejudge what's announced tomorrow, but there has been a great deal of speculation. And it was really, I guess, further to Willie Rennie's point about business preparedness. What thought has been given to trying to maximise the time here that businesses can prepare? Because with the best of all in the world, businesses in Dundee will have to make changes effectively over a weekend to start on Monday. That's tough. That's a tough call. And as you can imagine, I've had a fair amount of representation. So, going forward, what can government do to try and help businesses in that situation where, there may be rapid changes, but to try and make sure they get the maximum support available in a short period of time?
Well, as a general maxim, I think people should hope for the best but prepare for the worst. And I think that is probably a sensible maxim at these times of all times. And I think we have to be prepared. I hope that the new scrutiny arrangements, and let me mention those first of all, will help in that regard. I've laid out today a process which we hope will be very much the norm, which will give a number of days, a process of discussing how this should happen, change in levels, starting with a plenary statement on the Tuesday and concluding with the implementation, the implementation of the signature of the regulations on the Friday. That is helpful. There's clearly growing concern in areas, I don't want to be more specific than that, and therefore obviously there would be a desire for people in those areas to prepare for what may take place. I don't know if Jason wants to say a word or two specifically about the areas you're talking about.
I'm not sure I have anything specific to add other than what I said at the beginning about the pace of the virus is what really hurts us here. The ability to know what the virus is going to do and when, and from a public health perspective, delay is always bad. Now, that's just the pure public health advice for COVID. Then when you take the public health advice around business and economy and social effects, of course you then have to factor in time to get a business to do something, time to get a call centre to change, whatever it is you're then having to change. And the public health advisors are not disrespectful of that. We try to take that into account. But if you ask our pure COVID public health advice, it is do it as quick as you possibly can, because every infection today is a risk of serious illness in the future. And that's the nature of the infectious agent, not, I'm afraid, I'm not trying to deflect it, but not the fault of either the politicians in this occasion or of the advisors on this occasion.
Okay, no, I appreciate that. I just have one final question. Cabinet Secretary, you talked earlier on about some of the challenges around some of the large rural constituencies with potentially differing levels within that. Clearly, in areas like Dundee, they sit very closely to other local authority areas which may be in different tiers. So if you take the Dundee-Angus border, you'll have people living literally across the road from each other, but in different tiers. And there are travel to work issues there that have to be looked at. Is the government looking at those issues in regard to the new level system, where you have areas that are in different tiers but absolutely interacting, particularly in people travelling to work? Is that being looked at?
Absolutely, and it is of course a concern. But there is a difference. I mean, Jason, has been very clear about the South Lanarkshire situation, for example, where there is a huge rural hinterland in South Lanarkshire, but the services, the support, the essential services, and particularly in terms of ICU and ventilation, are the same for the whole of Lanarkshire. So taking a risk with that would be a risk that would affect those central services. There is a big difference, in my view, between, and I understand, that in Angus, there may be people in the same street who find themselves, one group in Dundee and one group in Angus. I mean, that is the nature of it. there's a difference between that, and I use my own example only because I know my own example well, than if you live on the island of Coll or Tiree, where you could, on a very, very good day, see the Western Isles. You can certainly see across to Skye and the Small Isles, and those are in a different category. But you can't see Helensburgh, but Helensburgh's in the same local authority area. So there are huge differences in some areas and smaller differences in other areas. Caution. Real caution is the important issue here. You should not take risks on this. And I think Jason was right to include the word presently or present situations. You only have to look at another area I know very well in Uist. Uist had virtually no contact with the virus until it had an outbreak some weeks ago, which was very serious and involved numbers for Uist that were large, and that can happen. So caution is really important, but of course we are and have to and will continue to look at those issues so that everybody is not only doing the right thing, but they know that the right thinking is taking place and that the right consideration is taking place of what should happen.
Okay, thank you.
Thank you. Can I turn next to Mark?
Yeah, thanks, convener. Can I just start by welcoming the update in the guidance for school sports that was sent to the committee on Friday, following our last meeting. That was a very welcome change there, bringing schools more in line with the guidance for communities. A number of teachers have got back to me asking when schools will be notified of that. I'm assuming that that's in train, that's happening this week, but perhaps if more update on that could be provided to the committee, that would be useful. Looking at the email. Sorry.
Of course. I mean, of course. I'm sure we will update you on that. We will find out when the schools had it or will have it, but I'm glad it was useful. Yeah.
The feedback's been good from teachers. Turning then to the EIS's submission to the committee, that they talk a lot about the work that was done by education teams across Scotland to prepare for a blended model in the summer, and a lot of very creative, excellent work that was done there. I mean, that work's not gone away. A decision was made at the end of the summer, young people to schools. You just described that as a sacred objective. But I'm wondering, within the context of the new framework, and particularly in relation to level 4 council areas, whether there's still a role for that blended learning potentially to swing into place, even if it was just for a few weeks, try and suppress the virus. Because it seems like we're ready to go. Teachers were ready to go with that. Still an option, but is it a political option?
Well, I mean, I don't think one should never ever say never. There may be circumstances, or might be. I don't want to say may. There might be circumstances in which you would have to change what is happening, but those are not anticipated, and therefore I think it's quite important, given the sensitivity of this subject and the crucial nature of this subject, that we make clear that having children, the children being in school, having the experience of learning, and making sure that as near as possible we have normality within education is something we are determined to maintain, as strongly determined as we have been. But I cannot ever say that something might not happen. And you are right to say there was a lot of good work done that therefore is not wasted and might be available. But I don't want to speculate on it, because it is certainly not our intention that would change.
Okay, thanks for that. If I could turn then to the experience of students and staff and the local communities in towns and cities where there are colleges and universities. I'm wondering about how we develop a more consistent approach to supporting people here. I'll give you an example. In Cambridge, I raised this at the previous committee meeting, there's asymptomatic of students and staff, 10,000 tests being done every single week in that university, and the university doing its own tests using its own facilities. If you contrast that with Perth, and the UHI campus there. There's no asymptomatic testing happening at Perth. In fact, there's no walk-in testing centre. Neither is there a drive-in testing centre or any testing centre in Perth whatsoever. And I've been informed by students and staff that there are people having to go to Dundee, possibly on public transport or car if they're fortunate enough to have one, to get tested there. Now, there seems to be a massive inconsistency in terms of, in relation to testing in particular, about the kind of protection that staff and students and the wider community can expect. And I'm just wondering if that's something that you're aware of, and if it's something you're concerned about. Again, in the EIS submission, they're raising concerns about the development of guidance, not in relation to schools, by the way. They're quite happy with that. But they've described the development of guidance in relation to universities as being patchy and rushed. So I'm just sort of wondering if you think we're in a good place with colleges and universities at the moment, and the testing issue. There certainly seems to be some major inconsistencies.
Well, let me ask Jason to talk about the testing issue, because I think that is an issue which has improved and keeps improving and is doing well in Scotland. I'm not entirely sure the comparison of Cambridge and Perth is the right one. There are walk-in testing centres, for example, in St Andrews. With the university there are walk-in testing centres in Glasgow, in Edinburgh, and there's continuing development of those all over the place. Indeed, they will be in non-college and university areas too. But perhaps Jason would like to talk about testing, which I think we should be pleased, though not complacent, about the progress that's been made with testing and the way in which it has moved on. And Jason might fill us in more detail.
There are two principal things in train, Mr. Ruskell and others, and that is, of course, an expansion of the PCR testing programme around the country, around the whole of the UK. Let's remember what it can and can't do. It cannot find the virus when you are incubating the virus. So asymptomatic testing, it is helpful in some circumstances, but it is not what people perhaps think it is. It cannot always find the virus. So if you are incubating it, it will not find it. It will find it roughly 48 hours before your symptoms, but that varies hugely from individual to individual. And it relies on testing technique and everything else. We know it then takes time to get you that result back, because the machine just takes time to do what it does. We now have 11 walk-in testing centres, which frankly have been developed, built and staffed at an enormous pace. And I'm hugely grateful to local health boards, to everybody who's put that together. And it's happened really quickly. I'm very happy to look at Perth in particular if we think there's a challenge in that particular locality. I'm not aware of there being a particular demand there that isn't met, but if there is, I will be very, very happy to look into that and get back to you. The second point, I think, is the technology is changing all the time. We have new testing technologies which are faster, probably less sensitive, but that may not be a problem for large-scale asymptomatic testing. But we are testing the test presently, as is most of the developed world. And they're not yet at a stage where you can deploy them at scale, but they will be. I'm confident that technology will come, and that will help us a great deal across the UK and in Scotland to get that level of testing up to allow us to do more asymptomatic testing for what you and others seek. I would balance that with the clinical view of testing. You have to have a reason to test, and you have to do something with the test when you use it, whether it's a mammogram, whether it's a PCR test for COVID, or whether it's a CT scan. So we are comfortable with asymptomatic testing, but only if it helps, only if it gets us something we didn't have before in the population.
Okay, just briefly, just follow up on that. The issue for people in Perth is that there isn't even symptomatic testing. So asymptomatic testing would be great, but if you've got symptoms and you want to get a test, you've got to go to Dundee. The only other option would be home testing. Do you think it's possible to do some prioritization for people who don't have access to a car, for example, or have a particular postcode so they can get a quicker home test? Because at the moment, I think you'll agree, it's not acceptable for people to be having to travel to Dundee to get a test if they've got symptoms. And we know that there are delays, of course, with the home testing.
So the home testing is run by the UK government in partnership with us, of course. But so the numbers of home tests available and the prioritisation within it, we can influence, but isn't necessarily a matter for us. I think we've struggled, rightly, because of the massive scale of this, to do prioritisation within the home testing regime. There are, of course, pieces of Scotland closer to drive-through centres, inevitably because of geography. And I'm very happy to ask my testing colleagues to have a look at the provision in Perth specifically, and Perth and Kinross maybe in general, and get back to
you. Okay, thanks.
Thanks for that. Next, Stuart McMillan, please.
Thank you, Convener. I'd like to go back to some questions that colleagues have posed regarding their areas, and it's regarding the documentation that was published this week on the 25th of October. It's on Table A, the indicators, signals and levels for each local authority. Like Shona Robertson, who asked some questions about Dundee, I'm going to ask a couple of questions about Inverclyde. Looking at that table, Inverclyde is certainly lower than any other local authority area in the West Coast within the NHS Greater Glasgow and Clyde Health Board area. But as has been widely anticipated, that we will come under Tier 3 as compared to potentially Tier 2. And looking at this indicator table, the hospital forecast seems to be the key driver in any type of, or in any decision for any tiering position. Is that the case?
I think I should ask Jason to answer that, given his knowledge of the background to this and the decisions being made on the tiering, as well as the wider national question, and I suspect it's a balance between the two.
It is precisely that. The gearing of the levels is not science. You can't publish a threshold and say this is the only thing that matters and this is how you become a 2 or a 3. That would be completely artificial, and it would remove the ability for judgment from local public health teams. You of course have to take into account, as I've described, I think, for Lanarkshire, what you would do around ICU capacity, around health service capacity, because the last thing we want is a fast outbreak in Inverclyde that we then can't cope with in our hospitals to protect the residents and citizens of Inverclyde. I think Inverclyde is different from the rest of the West. I think you're absolutely right. And the data has been relatively consistent now to suggest that Inverclyde took a really big hit in Wave 1, but hasn't taken such a big hit, to use shorthand, in Wave 2. We don't know why. And it's a very interesting research question about what is different about Inverclyde. We're seeing a similar phenomenon in London, where London is slower and less affected in a second wave than the north of England. And there are questions in there that researchers are presently asking about what that is. Is it a level of immunity? Is it behaviours? Is it? We simply don't know yet. The other challenge, apart from hospitals, is time at that level. So we're still concerned locally, the local public health leader in Glasgow and Clyde, but also nationally, that it's too early for that central belt to move downwards. And we're facing exactly the same challenge on the East Coast in the conversations with Edinburgh City and East Lothian, who feel they are in a similar position to Inverclyde. So Inverclyde will be, not to prejudge, will either be a 3 or a high 2, if you see what I mean. So it may be that Inverclyde will move down over time faster than some of the other local authorities, and it won't just be dependent on ICU capacity and hospital capacity. It will also depend on their individual preference.
No, thank you for that. Because certainly, when you look at the data that has been presented, and Inverclyde's position, and you touched upon that there yourself, Jason. regarding where Inverclyde has been, also where it was in phase 1, and also where things have over the last number of months. I would suggest that how the population dealt with phase 1 has certainly helped with the situation that we've had consistently for a number of months. I think there was an initial fear because of where Inverclyde was with phase 1. But I think people certainly took on board the rules, the regulations, and followed the facts and followed the guidance, because they didn't want that to happen again. Clearly, too many friends and family of individuals succumbed to COVID-19, and people don't want that to happen again. Sorry.
No, I was simply going to agree with you and add one thing that I perhaps should have said that's important. I understand that it's very, very important to get the first sets of levels correct, but those levels are not forever. So the public health advice will be, we will review this every week, and we will advise local authorities should be moved, probably not quicker than 3 to 4 weeks would be our instinct, because that's about an incubation period and a half of the virus. So you learn quite a lot in 3 to 4 weeks. So what happens on the 2nd of November is not fixed until March. And I think it's important that the residents of Inverclyde, just like the residents of every other local authority, understand. So initial tier is not the same as tier forever.
I accept that point. What I would say, though, to challenge you on that, is that because of where Inverclyde has been over the last number of months, and following the rules, following the guidance, and with our rates being a lot lower than neighbouring local authority areas, and this is something I touched upon in my contribution in the debate yesterday afternoon, I wouldn't want particularly the hospitality community in my area feel as if they're being challenged even more so because of what's happening elsewhere, when people within Inverclyde actually have done the right thing over the last number of months. So I also accept the point about the tiering. The tiering is extremely important, particularly on the first announcement, which obviously is going to be tomorrow.
Could I just make a point about this phrase, doing the right thing? I'm absolutely certain that the vast majority of people try to do the right thing, and that applies to licensees, to hospitality providers, to publicans, to restaurateurs, to individual members of the public. It is not a judgmental thing, which tier you're in and which tier you're not in. It relates to the objective evidence laid against a whole range of other pieces of information, some of which, like the national position, are objective, some of which, as with some of the four harms, will be more subjective, in order to come to a judgment. And I'm sure we all get people who say, look, I've done everything properly, I've done everything right. Why am I being victimized or penalized? And the answer is, you are not being victimized or penalized. We are desperate to help in any way that we can and to support. But this is about the public benefit and the public health benefit and the essential task of suppressing the virus and saving lives. It is not a judgment upon individuals, and we shouldn't in any way talk about that. Now, there are people who have behaved irresponsibly. They're a very small number. We see that reported. But let's be accurate about how we're approaching this.
Okay, and just I've got one other question that's on a totally separate area. It's just to do with the Delegated Powers Committee in the Parliament, and I sit in that committee too. Just also with the new proposals that are going to come forward for scrutiny, do you believe that they will actually aid the Delegated Powers Committee to undertake the work it needs to undertake regarding any new regulations?
Well, there is a place for committee scrutiny within that. It is of an important place. Whether both the COVID Committee and the Delegated Powers Committee or other committees wish to be involved in that, maybe the committees could, unthinkably come together and be involved in an evidence session or consider things. The importance is to ensure that the matrix does two things. It allows and encourages the maximum scrutiny, but it also makes sure, as Jason's indicated, that delay does not take place, which is dangerous. So, within that regard, it is not for me to say which committees will be involved in which way. I think what we are trying to do is to come to something that benefits all of us, both in terms of scrutiny and in terms of effective governance.
Thank you.
Thank you for that. Can I next turn to Willie Coffey, please?
Thanks very much, Convener. I wonder if I could ask a couple of questions, please. The first one's really probably for Professor Leach. Jason, it's about the numbers that we're seeing on a daily basis. I think in your earlier remarks, you told us that some between 1,100 and 1,200 a day occurring. Have you had any chance at all to look at the data and see what types of interaction and behaviours are principally causing these numbers to go up? Because I'm sure you know that families are always asking elected members, that the most important issue for them is not being able to see their family. So is there anything in the data that's telling you that that restriction is still very much the appropriate and correct restriction to keep in place? And is there any other intelligence within the data that you're getting that's given us any more information about possible relaxations or even possible further restrictions?
So the two most common questions I get asked, Mr. Coffey, either by elected representatives or the media or intelligence, are, why can I do this and not this? That's question number one always. And then question number two is summarised by, where is the transmission actually happening? Which is what your question is. Now, unfortunately, the answer is not particularly satisfactory for you, for me, or for the families. We have to go back to first principles and read the actual research on this virus and all viruses. But this one in particular thrives in particular circumstances. So we don't have very many actual causations. So Johnny gave it to Mary in this room. That's hard to find. But we know this virus likes indoors, it likes humid conditions, it likes lack of ventilation, and it likes people close together. So if you imagine that scenario, then that is households, hospitality, visitor attractions, all of those elements. And it is not, although not immune from transmission, it is not outdoors, parks, sport. You can catch it there, people have, but in the main, it's those indoor settings. And therefore, around the world, with WHO advice, with European CDC advice, every country has attempted to restrict those household interactions in whatever way they can. So we quite early on said no indoor household interaction. That's an enormous decision, a very, very difficult one for the politicians, and a difficult one for me and my colleagues to advise, because we don't like it, and we know nobody else likes it. The second is hospitality in general sense, and attractions and other places, snooker halls, bingo halls, other places where people come together. Again, not something we want to do, but we know that the evidence says those two areas in particular are where people mix, and that inevitably where the virus finds new households. This virus doesn't actually want to kill you. This virus just wants to find a new host. That's all it cares about. It just wants to find a new uninfected person to infect, and that's how it survives, because then it goes to another one and another one and another one. Now, the actual data for that we get from Test and Protect interviews. And we've seen over recent months, and we published it relatively recently in our evidence document, and more recently the next version of that, to suggest that household interaction is falling, of course, because we've prevented it in the main, and pubs and hospitality interaction is falling because we've prevented it. And that's one of the reasons why the doubling time hasn't happened. That's why we've got 1,100 cases today and not 2,300 cases or 2,500 cases. So we're going to have to hold our nerve. And if we hold our nerve and that number falls, then we will be able to gradually release some of those more stringent restrictions. And I can't believe I'm saying it in November 2020, but I'm afraid that's the nature of this infectious agent.
Thank you for that. That's so helpful to be able to hear that and to understand that. It's probably the most common question I'm asked by constituents about the impact of family. given that we're all doing what we're being asked to do, but the numbers keep going up and the restrictions continue to be in place.
I think you can. 2 weeks ago, you couldn't reassure them it was working. I think today you can reassure them that it is working.
Lovely, thank you. I wonder if I could switch to asking a question about outside contact sports that's been mentioned by the Cabinet Secretary and I think yourself. This is really a plea on behalf of my good friends in Ayrshire, the Amateur Football Code, who tell me they're unable to continue to begin playing, but their colleagues in the Semi-Professional Junior Code may well be given the go-ahead soon, and their plea is that they operate by and large the same regulations and guidelines and so on and so forth. So why the distinction between one and not the other to allow the Amateur Code to continue? They're very well run clubs, as you can imagine, so it's a common question I'm being asked at the moment, Professor Leach, so I'd be obliged if there's any information for that.
Me too. I'm being asked it a lot as well, and the layers of the sport from elite down to just kids playing in the park on a Sunday morning and everything else in between. There's two principal pieces of advice and regulation in there. There's the government's bit, so what we're saying and what we're saying about the tiers. And one of the things the tiers will allow is the travel restrictions in the tiers will look different from the travel restrictions just now. So just now we're saying if you're in the Central Belt, don't travel outside your health board. In the new version, we'll be saying don't travel to a tier that is different from yours in shorthand. So don't go from a high-risk place to a low-risk place. So that will mean, for example, if Ayrshire and Arden ends up in the same tier as the rest of the Central Belt, you will be able to move between them. So that will remove one of the challenges that amateur football clubs are facing, because they can't take a team from here and play a team over there. The other layer is what the SFA and the SPFL are giving as advice regulated clubs about how they should behave. And we're in constant touch with them, Mr Fitzpatrick, the Minister, me, other more traditional civil service officials in touch with them to try and make that guidance fit as well as we can. But some of those choices are a matter for the SFA and not a matter for government. We've tried to be as open as we can, and in the new restrictions, we're quite specific about what's allowed in each of those tiers. That came up in the debate yesterday. It's coming up with stakeholders over the last 48 hours. So the final version may not look exactly as it was when it was published at the weekend. So we're taking into account, of course, the bingo hall people, the sports people, all of that, and that will go to the Deputy First Minister and others today. And then the final tiers and the final tiering will be published over the next couple of days.
That's very helpful as well. Thank you very much for that. My last query is again about our shielders. Professor Leach, with the spike occurring and the numbers going up, is it still the same and the correct advice for our shielded group to continue as they have been for the past few months, or should we be asking them to protect themselves a little bit more because of the spike that we're seeing?
So this gives me an opportunity, Mr Coffey and Convener, to say a couple of things, if you'll forgive me. What we've tried to do in the recent publication of the draft tiers is we've tried to link the advice to the high-risk groups, so-called shielders, into those tiers. Now, at none of those levels are we telling people to stay in the house and cut themselves off entirely. We don't think that's appropriate for this pandemic, for what we now understand about risk. But we are asking people to assess their individual risk, whether it's their workplace or whether it's just them and their family, and then think about how they behave. And in summary, what we're asking them to do is to be extra careful in each tier with the regulations that the rest of the population are facing. So there is still a vulnerability, a high-risk nature to those who are obese, those who are elderly, those who have heart disease or respiratory disease. So we understand the risk group much more than we used to, and it's slightly different from what we believed it to be in March, to be honest, because the science has changed. So we now know that age and obesity are the principal two risks, then comorbidity or other diseases, and other things in that box. So the shielding list is now not the same as it was, and we're publishing advice to the high-risk groups at the same time as the tiers. So we would ask those who are at high risk attention, look at what tier your local authority is going to be in and be extra vigilant to follow those rules inside your tier. But we're not asking people to retreat completely like we did in March to protect them. And I hope we don't have to do that again, because that's one of the hardest pieces of advice I've ever had to give.
Yep. Okay, thank you so much for that. It's really, really helpful to hear that. Thank you, Convener. Back to you.
Thanks, Willie. I turn next to Maurice Corrie, please.
Thank you, Convener. I've got 3 questions. First of all, to the Cabinet Secretary. Good morning, Cabinet Secretary. Good morning, Professor Leach. Related to communications, and in Cabinet Secretary, in notifying the changes in regulations for the Scottish Government, which are so very important, what support and coordination has been given to local authorities on this to ensure that both the Scottish Government and local authorities and health and social care partnerships are in step, bearing in mind the new processes being implemented?
Well, I'm glad to say that the initial discussion with local authorities has been detailed, comprehensive, and will continue. It is really important when we're moving on to a local authority basis, and then the local authority basis becomes absolutely crucial, that the local authorities, and you're right to say the health and social care partnerships and the local NHS, given the situation, and know what those are able to understand the rationale and the reasoning for them, and are able to promote the terms and conditions that exist. So that is going ahead. That dialogue will continue. All of us have that dialogue, in our own areas, but also more widely. To be fair, as this situation has changed over the last few months, there's also been that dialogue. I mean, the Deputy First Minister has been instrumental in talking to local authorities when change of circumstances taken place. I've done that myself on occasion with Jason Leach when we've been required to talk to 1 or 2 local authorities and local representatives about what the situation is and why the regulations were coming in. So that is crucial. That is a partnership activity. That is a listening activity on both sides, and that will continue.
Right. Thank you, Cabinet Secretary. Now, this for Professor Jason Leach. Professor Leach, on the health and social care partnerships, what changes in communications do you wish to see implemented in relation to the communicating with the health and social care partnerships to ensure that any necessary actions by the Scottish Government required on the new process be implemented quickly?
I think one of the choices that we're making here is to devolve even more local decision making to the local public health teams, and they of course have to link with the operational providers, the health board, the local authority, social care providers, and the health and social care partnerships. I'm confident that is happening. All the calls I did yesterday, as I mentioned earlier with the Deputy First Minister, when we did a round of calls to local authority political leaders and executive leaders, all of them mentioned how well they were doing in relationship with their directors of public health. 14 individuals in this country who I think are probably the unsung heroes of this pandemic, amongst a whole host of others, of course, who are holding together a local public health response at a completely unprecedented level, that when the music stopped, they happened to be in those seats. They didn't predict it or desire it. So I think they and their teams are crucial to that communication. I think there's the second point with external communication to the population, whether they're in Argyll or whether they're in East Lothian. And that has to be clinically led, but helped by the political leaders, by the executive leaders inside those local authorities. And I think the communication locally in the local papers, on the local television and radio is absolutely crucial. There's only so much we can do centrally, and people are a little fed up perhaps with hearing me on the radio. So those local leaders, I think, are really, really important in telling the population, giving the population hope about how we may move through these tiers, how their behaviour matters to move through those tiers, what it is that they have to do in order to get more freedom. Because the hope is in time we will be able to move the populations around the country down this ladder in order to give people more opportunity to mix while keeping them safe.
Professor Leach, I'm absolutely delighted to hear that last comment. And would it be a way of possibly helping to enhance the communications Are you setting out a template to the health and social care partnerships, describing those, blue sky objectives, put it that way in marketing terms, to people to give them hope? Because that really now, and it's reflected in most of our questions this morning, is the hope at the end of the channel. We can cope with loads of things and lots of things, but for God's sake, give them something that they can hang their hat on, okay? So may I say that, Joe? I did chair a health and social care board in Argyll Butte before, and I understand the problems of communications is trying to work together. But the joy there in those partnerships is that they are half counsellors and half officials from the health boards. There's a massive amount of incredible expertise there, but an element of guidance from yourself would be very helpful on that. In say, here's a template. I suggest let's get those messages out, and obviously tailor them to those. What about that?
So I completely agree, and some of that happens already. So we have a head of what we call corporate communication in the health directorate in government, and he meets with the health board directors of comms, not just about news comms, not reactive comms always, but the proactive stuff, the stuff to the health service and from the health service. So some of the examples this week you've seen of the BBC being in the intensive care unit in St John's and Livingston, for example, to get that kind of local messaging out about how the health service is managing. Because, frankly, the second wave is affecting the health service in the same way as the first wave did, but we're not all clapping on a Thursday night anymore. So it's pretty tough to be a nurse in an intensive care unit or to be a manager of an acute receiving unit in Ayrshire tonight. And those are really difficult jobs, much, much harder than mine. And I want them to be recognised in this response to this second wave. And the population need to understand that and how their behaviours, the non-pharmaceutical interventions, the distancing, the hand washing, all of those things affect the way that health service will manage. So I completely agree with you.
Thank you, Professor Leach. Can I turn to the Cabinet Secretary for my third point? And it really follows on from Shona Robeson's question this morning. And it's to do with the excessive movement of population from a higher level area of restrictions, such as we experienced recently from Glasgow down the coast to Helensburgh and indeed Inverclyde. What considerations, Cabinet Secretary, are you considering putting in place or has been given by the Scottish Government and Police Scotland to prevent this happening in the future? Because we certainly learned some lessons from that.
There is very strong advice in place, and you've heard it again from Jason Leach today, and I'm happy to reiterate it, that the new tiers, the new levels, should indicate very strongly, should not move about the country, particularly from a higher to a lower area, and that you should not put yourself in the way of increased transmission. So when people want to move out of the area they're in, and that's understandable, they need to bear that strongly in mind. Now, we're not in a position where the police should be stopping people from crossing the street or doing things of that nature, but they should and are active in saying to people, this is not the sensible thing to do, this is the wrong thing to do. Now, of course, if people go further than that, we've seen today, for example, in reporting of a very small number of people being involved in gatherings of one sort or another, then action will be taken. But I think broadly people understand this and are now doing it and are now making sure that they aren't undertaking excessive movement. And that is really, really important. And we're going to continue to emphasize that very strongly. Of course, we can put it in regulation. And indeed, the indication is on the levels that we have, that those are underpinned by regulation. But we have to continue to seek to take this forward as much by consent as possible, and I hope that's what we will do.
Thank you, Cabinet Secretary. And one final point, Convener, if I may, to Jason Leach, and it's on airport testing services. Are you close to getting this agreed with Scottish airports in Scotland?
There's ongoing conversations with the sector. There are some trials beginning, some pilots, forgive the pun, in Heathrow and elsewhere. Again, I go back to we'd quite like new technology, like I described earlier, for the student population to help us faster tests. This present test just simply takes hours because of the nature of it. And you can't find the incubating virus. You simply can't find it. So therefore, it is only as good at what it does for what it does. It can't do something it's not designed to do. We are watching around the world as different countries take different steps to test on different days of quarantine, and we keep that under constant review. But importation is really, really crucial. It's a massive risk. If you get the virus down around the world, your next risk is importation. Whether you're New Zealand or Scotland or Somalia, you run the risk, even having reduced the prevalence, of then importing new families of virus. And that makes us really, really nervous, particularly as we begin to see some good signs in levelling off of our present position. We've got to be so careful not to open that back up again.
Right, okay, thank you, Professor Leach. Thank you, Convener.
Thank you. Our final set of questions comes from Annabel Ewing, please.
Good morning, Convener, and good morning, Cabinet Secretary, and to Professor Leach. My first question, I guess, would be to both gentlemen, perhaps starting with the Cabinet Secretary and moving on to the Professor. And just listening very carefully to this morning's evidence session, if we take hospitality again, I mean, it's very clear that downstream there are many, many others affected by what is happening or not, as the case may be, in the hospitality sector. So, for example, taxi drivers, for example, those operating on high streets in a whole host of different businesses, just to take two examples. Culture, again, cultural sector. So there are many, many people affected by what's happening in hospitality, in addition to those working in hospitality. In regard to hospitality, I listened very carefully to Professor Leach's response, I think, to the Convener about efficacy and how you seek to measure efficacy. What I would raise is, how do you communicate better efficacy in terms of assessment of what you're doing and why? And I was listening on the radio this morning to representatives of the hospitality industry who were not, it's fair to say, very happy. And one point they raised was, well, you know, somebody explained to me why 8 o'clock and not 6 o'clock, why 10:30 and not 10. Now, I guess if you're running a business, these are key questions to you. If you're not operating that business, but operating the public health of Scotland, you perhaps would say, well, in the round, we need to look at public health and do the job the best we can. And I welcome the strategic framework, because the tiered approach will indeed facilitate greater local response to local circumstances. And I think that is really important, because if we look at level 2, these changes are indeed being made. And I think it seems, hopefully, the vast majority of local authority areas in Scotland will be level 2 or below. But for those not in that, they want to know, they think this is arbitrary. And obviously, from the public health side of things, you do not believe that. You sincerely don't believe it's arbitrary. I just worry that there's a gap in the communication of that important, really important message. Because as I say, it's not just, and there are many, many, many thousands of people working in hospitality in Scotland, but it's many, many other people's jobs as well. And this is getting very serious for folks. So I would just ask, what reflection can be given on better communication of the whys vis-a-vis in specific individual decisions like 8 o'clock and not 6 o'clock, for example? Perhaps I could start with Cabinet Secretary and then Professor Leach.
It's a good question, but I think you have to step back from it and to say, if there was an exact science in this, then we could explain that absolutely. There's a textbook. This says if you do such, then such and such a thing follows. There isn't. And yesterday's debate, I think, usefully illustrated, as some of the discussion today has illustrated, the interaction between the scientific opinion based upon observation and based upon fact, and often based on experimentation, clearly in the scientific method, a wider group of considerations and the judgment you apply and individuals apply to those matters. So it is not an exact science. But what we are endeavouring to do, to put it crudely, is to diminish the effects of alcohol and mixing, either together or separately, because we know those are crucial intersections that allow this virus to spread in the way that Jason has described and we are now familiar with. So how do you do that is a question. And it could be that there is some brilliant way of doing this that we have not yet thought of or has not been brought to our attention. But it's not a criticism of anybody in the hospitality trade or any individual to say that you require a pretty broad brush to diminish the effects of alcohol and mixing. And you have to draw lines to do so. And the worse the problem is, probably the tighter the lines have to be drawn in order to get the outcome that you are seeking. So I think we need to, I won't say who it was from, but there was a contribution in this debate, which seemed to think that there was hidden away somewhere a magic formula, which, if only you applied it, solved all these problems, and the government was hiding it from people. If only was the case, we would publicize that magic formula instantly. There is a judgment to be applied, which brings together the right tools to have the right effect on the issues of alcohol and mixing, the desensitization of alcohol, the mixing issue, sometimes in very difficult circumstances, for example, at funerals, or in happier circumstances at wedding, the combination of alcohol mixing and celebration or mourning, all those things need to be judged very carefully. And there's a circumstance in which all of us, I'm sure Jason is in the same position, do not want to be the people who in the end have to reach that judgment. But somebody has to reach that judgment and say that's where we think the line has to be drawn, in all humility, and recognizing the difficulties that Willie Rennie raised in terms of compensation. So that is what is taking place. And when I hear from, as I do hear from, every day, people who run pubs and restaurants in my constituency, I try and make it clear that that is where we are. And I hope some at least do understand, and we would be really, really happy if we weren't there. And we look forward to not being there. And I want to make that very quick point about something Maurice Corrie said. He said people need hope. They do need hope. And the hope is this is going to come to an end. This is going to come. But it will come to an end sooner and more completely and with less damage if, in our judgment, these things are applied.
I think Mr. Russell has put it actually very well. Because of the uncertainty, there was a British Medical Journal editorial this week about the uncertainty of a pandemic, because you simply cannot know everything that you want to know. So I also heard some speeches yesterday, and I would love to be able to give numerical answers to some of those questions, but they are impossible, simply impossible to answer in every country in the world. Let me just remind you that Madrid's pubs and restaurants are closed. Dublin's are closed. Paris's are closed. Every country in the world is trying to reduce household interaction because we know that's where the virus spreads. When we closed everything, we got to single-figure infection rates per day. That's how it works. So therefore, now we're in a position where we are trying to balance the advice around opening businesses, opening the economy, and protecting the population. So the answer to why 6 and not 8 is to reduce the number of household interactions. Why 10 and not 1 a.m. is to reduce the number of household interactions. The simplest thing to do would be to close everything and get the numbers back down to single figures very quickly. But you can see how that works. Then you start to open up and the numbers go back up again. So all of the variations in timing, in alcohol, yes, no, in cafe, restaurant, yes, no, are all about reducing the number of occasions when people can socially interact in order to reduce the prevalence of the infectious agent.
I thank both the Cabinet Secretary and Professor Leach for their answers. I do very much take the point, and particularly if we look at international examples. I understand that Germany today will be meeting, President Merkel and others will be meeting to decide whether there should be a 1-month closure of all bars and all restaurants in all Länder in Germany. So, this is happening. And as I've said before, I think it's important that, we try to always put ourselves in an international context to the extent that there's any relevance, because this is indeed an approach that's being taken in a much more restrictive way in so many other countries in Europe. But I do feel that it's also very important always to remember that any of these decisions are impacting directly on people's livelihoods, and the language used around that then is really, really important, because these people have to pay their bills. and their rental contracts with their landlord and their mortgages, and obviously they will be extremely worried as to how they managed to do all of that. My other question, if I may, Convener, is probably directed to the Cabinet Secretary, but if Professor Leach wishes to comment, that's fine. And it was just to pick up briefly a communication, a submission we received from Deaf Scotland, and they reminded us all of our obligation in terms of inclusive communication, which is a statutory obligation, and they were a wee bit concerned that in terms of responses to the pandemic, this key obligation, looking at various people affected in different ways in the deaf community, are not being best served, and that they hope that a reflection could take place just to ensure that in all manner of communication that this issue was very much at the forefront, because communication, as we have been talking about all morning, is absolutely key to getting through this pandemic and getting buy-in and the compliance, and that must include every citizen of Scotland. So perhaps the Cabinet Secretary could assure Deaf Scotland that this matter will indeed be reflected upon. Thank you.
Well, it is reflected upon. I mean, clearly we have signing, at the First Minister's press conferences, which is important, and that continues. I am acutely aware of the difficulty that mask wearing creates, both for those who lip read and also those who have any hearing difficulties. Indeed, even if you don't have a hearing difficulty, it's sometimes difficult to hear what somebody is saying from behind a mask. So we are aware of that. We are aware of the Mary Fee raised at the start of this question session, the whole impact of the emergency regulations, of the legislation, and of our actions on human rights in the broadest spectrum, and will continue to be aware of that. And people will draw to attention, individual groups will draw our attention to things, and perhaps piecemeal will change and develop. We will also be conscious of our wider obligation, and still are.
Thank you.
I would simply say, Convener, that I completely agree. I have learned how to subtitle video clips. I've engaged with the community on an individual level. I've done some stakeholder engagement events digitally with both that community and many, many others to try and get both the message across, but also to hear from them about what would be helpful, how they can help us. So I'm very conscious of each of those groups, and we're trying as hard as we can to make the communication accessible.
Thank you, Professor Leach. Thank you, Convener.
Thank you, Annabelle. Can I just, before we say farewell to the panel, I've just got two questions of clarification. The first is about travel and restrictions on travel. Just for my own peace of mind, is it the case that if you travel from, say, a tier 2 area to a tier 1 area, then that is prohibited unless you fall into one of the exemptions, such as travelling for work or education, for example? And to take the example of the Cabinet Secretary, if it happens that a local authority area, such as Argyll and Bute, is able to be divided up between, say, mainland Argyll and the islands, if they are at different levels, will travel, for instance, be prohibited within a local authority area under the same rationale?
Well, I think prohibited is a strong term. I think there's a strong discouragement from travel, but there are exemptions and there are also necessities. I think the issue you have about the Argyll Islands is an issue that requires to be resolved. If people are, and you are aware of this, Mr. Cameron, as I am aware of this, if people are saying we would like to have a less restrictive approach, does that also say that they are willing to accept a more restrictive approach, for example, on ferry services? Now, we went through this in the early part of the pandemic, in the first wave. There were many, many difficulties in terms of issues of travel. They were resolved by common sense. This will require, I think this is another reason why we need to look at this more closely before there is any, if there is any differentiation. I don't want to assume there will be. We need to look through this very carefully to see whether that is a concomitant obligation, and if it is, how it is managed. So I think we move on from that, but what we are trying to do, and I'm sure Jason will underline this, is to stop the spread. That's what we've been talking about. And we're talking about stopping the spread, then going from area 3 to tier 3 or level 3 to level 2 isn't a sensible thing to do. Jason.
So the world is presently divided into two types of countries. Global response number 1 is close everything, get the prevalence to as close to zero as you can, build a wall around your country. That's global response number 1. A number of countries have done that. New Zealand is the poster child of that type of response. It has a specific location in the world. It has a specific island nature. Global response number 2 is try and have a regional response that doesn't need you to open and close all the time, with the other global response you see around the world, which is the involuntary open and close, open and close, open and close. And the regional response, though, of course, allows you to be more specific about what restrictions you have, but the implication for that is you have to stop importation of cases within country as well as out with country. Now, what unit of population you use is a matter for each individual country. So that will be different in Switzerland as it will be in Scotland. Of course it will. And that takes you into conversations about Miss Robinson's point about streets in Angus versus Dundee, and Mr. Russell's point about the Argyll Islands and a host of others. The public health advice in the first set of tiers will be simplicity is crucial. So we want to just move, if we can, most of what we're doing just now, which is working, into the new tier system, and then think about the intricacies of perhaps moving things around within there. And the fundamental advice in the draft pre-debate, not judging what will happen tomorrow before the First Minister makes those final choices with Cabinet. The pre-debate draft said you shouldn't move from a high-risk area to a low-risk area. So you shouldn't go from a 3 or a 4 downwards if you're in a 3 or a 4. And presently, remember, we have advised travel restrictions. Our advice is that you shouldn't move in the central belt out with your health board. So you shouldn't go from Greater Glasgow and Clyde to Lanarkshire to visit your family, which applies to me on an individual level.
That is, can I just make it, Convener, that is a crucial point I want to emphasise that Jason has just made. That is the existing advice. We are not going to be suggesting that advice changes. So that is the existing advice. And observing that advice, and most people have observed that advice, is very important.
So thank you both for that clarification. My final questions was just to ask the Cabinet Secretary to repeat, if he wouldn't mind, the parliamentary scrutiny that he announced at the start of his evidence in his opening statement, because that was new, I think. And I just for the record and for the sake of other members, if you could just go through that one more time. I apologise for asking him to do that.
I think the First Minister presaged it yesterday, and of course we have had good discussions with a variety. And I think Graham Day talked to the Bureau about it yesterday, but I'm happy to do so. What I've said is that when a change is proposed, and I'll just quote it exactly again, when a change is proposed to the levels approach approved by Parliament last night, the Government will advise Parliament of the proposed change by way of a plenary statement, normally on Tuesday. Members will be able to question the Government on the planned change. Draft regulations will be published, normally on a Wednesday. If it so chooses, a committee may wish to take evidence from the Government. We suggest Thursday morning. By saying a committee, I'm not saying that's a single committee. It may be a group of committees or whatever. Following any committee consideration, the Government would make the regulations to come into force at an early point on Friday. They will be mindful of the committee's observations. In exceptional circumstances, the Government would propose to facilitate a plenary session on Thursday when very significant regulatory changes were in prospect. The expectation is that the normal approval process and plenary vote on the regulations would still happen at a later date. Parliament would therefore be able to offer a view on the regulations both before and after they are made. And that adds a significant additional scrutiny dimension.
Can I thank you for that? And can I thank the Cabinet Secretary and all his accompanying officials for their evidence this morning. That concludes the public part of this meeting. Members will now discuss agenda items 3 and 4 in private, and I invite members to change over to Microsoft Teams for the next part of the meeting. And can I now close the public part of this meeting? Thank you very much.